Welcome to LINNC Paris 2022, and we have the honor to be with Professor Raul G. Nogueira. Almost. Sorry about the pronunciation. I believe you're going to talk to us about a trial that you're about to release information on basilar artery occlusion. Do you want to speak about that?
That's correct. It's the so-called attention trial that was conducted in China. We presented the results at the last European Stroke Conference not long ago. There was a second trial called biopsy. So the first trial called attention focusing the 0 to 12 hour time window versus the second trial that was presented by my colleague Tudor Joven, 6 to 24 hour window. So focusing on the early trial, essentially you randomized 340 patients in a 2-to-1 manner. So 2 patients got thrombectomy for every one that got best medical management. Okay. And what you were able to demonstrate was very much like you saw before in the anterior circulation, an overwhelming benefit of mechanical thrombectomy. Essentially, at 90 days, the rate of favorable outcomes, which in this trial was defined 0 to 3, was 46% in the patients that underwent mechanical thrombectomy versus just about 23% in the patients that only had best medical management. So that translates in a risk ratio of 2.1. Not only that was the primary endpoint, but all the secondary endpoints also favor mechanical thrombectomy. Specifically, when you look at the original shift analysis, the common odds ratio is 2.8, meaning you were almost 3 times more likely to have any degree of lower disability at 90 days with mechanical thrombectomy than medical treatment. Also, the risk ratio for functional independence at 90 days was over 3, precisely 3.2. So at 90 days, over 3 times more likely to be functionally independent, maybe not completely normal, but being able to care for yourself, return to work and all that. Finally, there was even a benefit in mortality with a risk ratio of 0.7. So it's one of the first trials to actually demonstrate a mortality benefit with stroke thrombectomy. And that happened despite a no complication that you have with acute reperfusion therapy, which is symptomatic intracranial hemorrhage, which happened in about 5% of the patients versus in none of the controls.
And what is the next step in this process now? Because this is an early trial, so it's 300 patients.
So the importance of these trials is many of us believed that was the case, but you had 2 trials that were inconclusive in this space of basilar artery occlusion. We had the BEST trial done in China that we had problems with a lot of crossovers. There were equipoise issues. And another trial called BASICS done out of Netherlands, but also other European countries and even Brazil in South America, that also you run into equipoise issues, long duration of the trial, maybe some selection bias as well. So there was uncertainty if there was really a benefit of mechanical thrombectomy in posterior circulation, but now, after these 2 trials, you can more confidentially affirm that this is a beneficial treatment. So when you approach families, you can tell them, listen, you know from randomized clinical trial data, level 1 evidence data, that you should be performing this treatment.
Well, thank you very much for sharing that with us.
My pleasure. Thanks for having me.